Hello, this is Dr. Adam Kopsky from Advanced Rehab and Medical, and I'm on here to discuss our topic we got this week. It's actually on runner's knee and knee pain. And so once again, when you come in each week, these are over by the rehab station, by the whiteboard. Grab them. They actually are very informative, especially maybe you yourself don't have pain or knee pain, but one of your loved ones at home or someone that you know has knee pain, it could really help them. And so what I want to discuss a little bit about what it is. And so runner's knee is actually the most common knee condition that affects 25% of all adults. And so what happens is that we get a gait imbalance, and so typically either at the hip or the back, if that is off, it allows our whole pelvis to shift, and now we're stressing the knee. This can also occur if we have foot dysfunction. So you'll notice a lot of you that come in, we always typically will look at dysfunction from the feet or the back because our knee is in the center point of dysfunction that can occur there, and that is typically the most common cause where our knee pain happens is above or below the chain there. So one thing that actually happens, you may notice if this condition progresses, some of you may notice some grinding or popping in your knee, and so that is actually on a continuum of where it starts as a dysfunction, then that stress, if it's not alleviated, can turn into arthritic pain, and so that is typically that cartilage underneath your kneecap will start grinding. So one thing that can really help you guys at home is just rest. I know that's tough if you're very active and want you to be active, but if this stress is not alleviated, then you got to rest it. So just taking time off from the gym, if you do a lot of squats, going up and down the stairs, just be mindful to rest and let it heal. The other tip is that if you come back next week, I'll go over one very critical exercise that can really help this. And if you have questions, by all means, post in the comments below, and we'll look for you next week.